The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Thanks for joining us today for the July installment of the Clinical Conductor webinar series. My name is Lauren Michelli, and I will be your moderator for the webinar today. Before we get started, there are a few housekeeping items I wanted to share. First, we will be providing a copy of the presentation via email within 24 hours of the webinar ending. Please be sure to check the email you registered for the webinar with. Also, we will be doing a question and answer session at the end of the presentation, so please submit any questions you have at any time using the GoToWebinar questions box on the right-hand side of your screen. Today's presentation is titled 5 Must-Knows to Ensure Your Site Stands Out During the Site Selection Process, and will be presented by Alex Binger and Lindsay McCarthy from PharmaSeek. Alex is a senior site selection specialist where he works closely with both sponsors and CROs, as well as research sites on getting PSVs and SIVs scheduled and making the connection between big pharma companies and clinical research sites. He assists sponsors and CROs in their site selection efforts, helping them identify quality sites to participate in clinical trials. Alex holds a Bachelor of Science degree in Consumer Affairs from the University of Wisconsin-Madison. Lindsay is the Vice President of sister companies PharmaSeek and PatientWise. She has over 10 years of clinical research experience. In her time at PharmaSeek and PatientWise, Lindsay has facilitated and implemented efficiencies between sponsors, CROs, and sites, specifically during the feasibility and study startup process. Lindsay and her team provide administrative services to research sites. These services include study identification, contract and budget negotiation, marketing, patient recruitment, and financial services. And with that, I'm going to turn it over to Alex and Lindsay.
Muted.
Thanks, Lauren. Good afternoon, everyone, and welcome. We're excited to bring you this site selection webinar today. As Lauren mentioned, we've got about an hour for this webinar, so we're hoping to present within about 45 minutes and then have about 15 minutes for questions and answers at the end. So again, welcome. My name is Lindsay McCarthy. I've been involved in the site selection at the site level for a number of years. Currently, I'm heading up the efforts at PharmaSeek, which is an investigative site network of about 240 sites, where our primary focus is to assist sites in site selection. My co-presenter today is Alex Binger, also from PharmaSeek. Alex, I'll let you go ahead and introduce yourself.
Thank you, Lindsay. My name is Alex Binger, and I assist our sites throughout the selection phase and advocate on their behalf. During the last 6 years at PharmaSeek, I've worked closely with hundreds of sponsors and CROs to provide them with high-quality research sites for their trials.
The site selection process can be difficult to understand. Our goal for this webinar is to help you see clearly through the process and stand out among the pack. We'll be going over 5 must-knows to get your site recognized and selected for upcoming studies. We'll be going over tips for getting your site to the top of the site selection stack, best practices to overcome shortcomings and still be a selectable site, how to have a successful PSV, learning when to decline a study, and planning for the future of your site. As you can see by this next graphic provided at last year's Site Solutions Summit, the site selection process on average is a lengthy one. Site selection itself usually takes over 3 months to complete all CDAs and feasibility questionnaires from sites. And then we have another 8 months from the beginning of PSVs to final contracts being executed, and an additional 2.5 months for site activation. This consistently drawn-out process has become the norm for clinical research, as we're constantly playing the hurry up and wait game. Another graphic provided by GoBalto and the KMR group details the length of time it takes to execute a study contract. As you can see, Asia Pacific takes over 15 weeks on average, with Latin American countries often taking over 17 weeks to finalize, and North America coming in just under 10 weeks on average. But this trend continues, and the delays can prove very costly to sponsors.
So before we jump into our objectives, it's important to understand the bigger picture first, so you know what your site is up against. The Tufts Center for the Study of Drug Development released a very informative study in 2017, and the results, on average, still hold true in 2019. and the research done 10 years ago on this topic provided similar findings. They analyzed over 150 clinical trials involving almost 16,000 sites worldwide. Most of the results are consistent with the long-term problems plaguing the research industry, although some of them aren't as dire. Tufts found that for a given study, an average of 11% of sites won't enroll a single subject. On the bright side, that seems to be well below the 20% or 33% figure that usually gets floated around. 37% of the remaining sites will miss the enrollment goal. 39% of sites will meet the goal, and 13% will over-enroll. This means that nearly half of all sites on a given study won't meet the target that the sponsor has set. While 9 out of 10 studies worldwide will meet their enrollment goals, the downside is that the sponsors often have to double their original timelines in order to do so. Other research has shown that on average, over 80% of clinical trials don't meet the sponsor's original timelines due to poor enrollment, and most trials end up doubling their original timelines. On average, it costs the sponsor about $40,000 per day to keep a trial running, just in direct costs. With trials often lasting 6 months or more past the original deadline, the total cost can easily spiral higher and higher. And this doesn't even begin to take into consideration the less tangible cost of how long the drug is potentially being delayed from the market. Estimates vary, but the typical figure we've seen is that sponsors lose $1 million for every day that a drug is delayed from entering the marketplace. For blockbusters, this amount can shoot up to $5 million per day. Also, poor choices in site selection can increase the cost of a clinical trial by as much as 20% or more. Part of this cost includes activating and closing out non-performing sites. If a site doesn't enroll a single subject, the sponsor just wasted $30,000 to get them through the selection process and initiated just to have them closed down with no return on their investment. According to the Tufts Center for the Study of Drug Development report published in March and April of 2018, we are seeing similar patterns of inefficiency. The time needed to select sites and begin the study takes an average of nearly 8 months, which is about a month longer than it did a decade ago. Mary Jo Lamberti, senior researcher at Tufts who led the analysis, noted, overall, a high percentage of sites under-enroll, and 1 in 10 sites are never activated, which reflects that process improvements have not been made. But it's not all bad. The study also noted that 28% of engaged investigative sites are new relationships with no prior history or familiarity of working with a CRO or sponsor, a high proportion that is expected to increase as more clinical trials focus on rare diseases and highly targeted patient subpopulations. This is good news for those newer sites that are looking to break into research, as well as a way to make connections and start building relationships. The overall site initiation cycle time is 9.9 weeks shorter for repeat or familiar sites compared to new sites. And about 30 to 40% of sponsors and CROs report that they are somewhat or completely unsatisfied with their site initiation processes. Also, CROs, compared to sponsors, complete the site initiation process an average of 5.6 weeks faster for repeat sites and an average of 11 weeks faster for new sites. So how do all of these facts and figures affect you? As I'm sure many of you have seen, given the way the industry has trended, it can be difficult to break through and start practicing in the clinical trials you really want to work on. There is a high level of competition between sites as the sponsors are under increased pressure to identify the best sites and make the site selection process an easy one, but it often doesn't work out that way. In such a rapidly globalizing industry, U.S. sites are also under more stress. They have to constantly prove their worth to sponsors and make the case for why the sponsor should choose them rather than a site overseas. And that other site may have a much larger pool of research-naive and treatment-naive patients, and they may be willing to conduct the study for a fraction of the cost. Sites need to make an extra effort to get sponsors to notice them and earn their trust. Being able to build relationships with sites is another big factor when it comes to working with sponsors and CROs. If you had success on a previous study with that sponsor, the odds are good that they will reach out to you for the next opportunity. Going above and beyond will help your site stand out amongst the rest. Many times we have seen a CRO working off of a sponsor-approved site list, where they only selected sites they had previously worked with. Although this certainly doesn't happen every time, making a good impression and allowing the sponsor to refer back to the good work you did previously will put you near the top, right at the beginning of the process, and greatly increase your chances of participation. This can also help them cut down on costs later on, like being able to avoid sending a CRA to visit your site or other administrative or startup costs they could incur throughout the site selection process. Research sites building relationships with sponsors benefits both sides, but sponsors often work off of a previous site list, and this can be a huge advantage to increasing the study pipeline at your site. One trend the past several years has been for sponsors to hedge their bets by increasing the number of sites per study while decreasing the number of subjects each site is expected to enroll. You see it both ways sometimes, but sponsors do take this approach as well. This theoretically increases the likelihood of the study meeting the enrollment goal on time, but it certainly makes conducting research much less attractive for sites. When a site is limited to enrolling 3 subjects on a study instead of 10, it's much harder to recoup their investments.
What sponsors are targeting? As most of you are aware, sponsors and CROs are looking for sites that can meet or exceed enrollment goals and produce clean, high-quality data. When possible, sites with previous study experience, especially given that indication. Access to patient population is another huge selling point, and being able to tell the sponsor that your site has a dedicated recruiter on site. If your site has access to one, make sure to let the sponsor know. Qualified investigators, coordinators, and other staff such as CPI, CCRC, CCRP, GCP, and rater certifications are also a plus. While we've yet to see a sponsor require CPI or CCRC certifications, being able to put those letters after your name is really a fantastic selling point to show the sponsor how committed you are to conducting high quality and high integrity research. If the PI doesn't have experience, whether or not the site staff has experience will be a huge factor. It's always tough to break through if you're a new PI, but if the site staff has experience, that's a big plus. Sites with a clean regulatory audit history, a 483 is not always a deal breaker, but we'll touch more on that later. Sites that are geographically dispersed, which is important for certain indications like flu and seasonal allergies, and if sites are expected to rely heavily on advertising or other external sources for subjects. And finally, sites that can move quickly throughout the study startup process without lengthy contract review times or local IRB timelines. Try to take no longer than 3 to 5 business days for contract and budget review, and work with a central IRB to expedite the regulatory process. I'm sure a lot of these are common sense to you, but geographic dispersion can be a huge factor. I'm sure if you're a site in California or Florida, you've heard the sponsor many times say they're oversaturated in that area. That's why it's best, if possible, to jump on a study as soon as you hear about it. The site selection process is incredibly competitive, and even if your site appears better, the sponsor probably already has a site in that area that they're moving forward with, and you may not be approved simply based off geography. The ability to get up and running quickly is another big one. For some studies, sponsors may be adding sites late in the process and have hard deadlines. If these are not met, regardless of your experience and capabilities, you may not be approved simply just because you took too long. So now that we've gone over what sponsors are looking for in a quality site, what can you do to measure up to their needs? We'll go over some of the best practices on how you can make your site stand out. Here are the tips I'll be going over. Meet your deadlines and always be responsive. This is absolutely huge. You'll want to be responding in a timely fashion because sponsors will notice this right away. Take your time and work diligently on the questionnaire, almost treating it like a job interview. It's going to be your best shot at being considered for next steps in the process. Under-promise and over-deliver. You don't want to be overshooting your numbers and then falling flat. Anticipate red flags. Don't give the sponsor any reason to doubt your ability to enroll and provide quality data. Be proactive and follow up. Make sure the sponsor knows how interested you are.
The first tip, and I really can't stress this enough, is to meet your deadlines. This may seem obvious enough compared with other factors such as your experience and access to the patient population, but I can't stress enough how important promptness is. The first impression a sponsor will typically get from your site is how quickly and accurately you complete and return initial paperwork, such as CDAs or feasibility questionnaires. A site that takes 2 weeks to get the PI to sign a CDA comes off as a site that doesn't really care if they get the study or not. Plus, this initial communication sets the tone for the sponsor's expectations of how you'll behave on the trial. If the sponsor needs to continually follow up about an outstanding CDA or questionnaire, they make note of that and will keep that in mind in regards to your slow response time. Also, some sponsors and CROs do keep metrics of turnaround times for documents, so repeatedly missing deadlines can be detrimental to your chances for selection, even if you may be the perfect fit for the trial. This does, however, lead into the next tip. If you can't make a deadline or a CDA signatory or the PI is on vacation, let the sponsor or CRO know right away. These deadlines are generally not set in stone, but this way the sponsor or CRO knows you're working on it and not just ignoring them, and they'll certainly appreciate your level of communication. They understand that sometimes a coordinator needs to set up a time to meet with the PI and gather information, or just for general things like signing a CDA. But as long as you are able to communicate with the sponsor that an extension is needed, 99% of the time they are okay with that and will appreciate that. Keep in mind that oftentimes sponsors are looking to add sites to a study quickly as an add-on or rescue site if their site selection window is very small, and sometimes they might need feedback from you within a few business days. So it's always good to take care of signing CDAs and getting questionnaires completed as quickly as possible to ensure your site is properly considered. I've seen it numerous times where a sponsor needs to quickly bring on a number of sites to a study, and the first 10 or so sites that complete the questionnaire will get a PSV, simply because the sponsor is in such a rush. These are still high-performing sites, but it shows how quickly things can move in this industry. So it's always in your best interest to get your documents submitted so the sponsor has access to your information early on. Our next tip is about the feasibility questionnaire itself. We all understand it can be tedious and sometimes discouraging to fill out questionnaire after questionnaire and feeling like you're submitting the same information on each one with no payoff. But it is very important to take your time completing the questionnaire, as this is your best chance to move forward in the site selection process. Obviously, turning around the questionnaire in a timely manner is important, but what you include on the questionnaire will be the biggest factor in the sponsor's decision whether or not to move forward with your site. Don't leave any questions blank, and don't limit yourself to just checking boxes and filling in numbers. Use open-ended questions and comment sections to your advantage. Some questions will require numeric answers only and don't give you the chance to explain what your site has to offer. But take advantage of the open-ended questions that ask you to describe your site setting, your research experience or patient population, referral abilities, and anything else that would help your site stand out amongst the rest. For example, our site has 1,500 subjects with type 2 diabetes in our database, including 6 providers with additional physician databases for referrals. We can also advertise if required. Sponsors definitely prefer sites that can recruit their own subjects or utilize referrals, as opposed to requiring advertising dollars. The sponsor will take notice of the fact that you went the extra mile in showing them how interested you are, as well as everything your site can contribute. If you have worked with the same sponsor on other trials and succeeded, remind them of that. The sponsor doesn't always refer back to previous site lists or study records. It's also important to have a standard review process in place for the opportunities you apply for. This way, you can quickly and efficiently conduct a thorough evaluation of the study. You can then provide optimal answers and determine if the study will be a good fit. You may want to create a checklist of items to look for when reviewing a synopsis and questionnaire. That way, you know what to ask questions about if the answers aren't already there. If the protocol synopsis includes a study drug you aren't sure about or an overnight stay that your site may not be able to accommodate, it might be best to wait for a study that's a better fit. But if you're unsure, don't be afraid to ask questions. If you know the study is already active, finding out how much time left to enroll is crucial. You can also include a list of selling points to make sure you include on each questionnaire, such as how your coordinators and PIs all have CCRC and CPI certifications and 10 years of experience. Or if it's a study with the same indication that you have done 20 times previously, you can include previous enrollment numbers or illustrate how the inclusion-exclusion criteria may be different, and you can perhaps enroll a higher number in this particular study. Having that review process in place can really help in getting your PI and staff on board and knowing the best approach to take when the study begins.
So tip number 3 is to underpromise and overdeliver, and it actually brings up a very interesting theory called Lasagna's law. This law states that the incidence of patient availability sharply decreases when a clinical trial begins and then returns to its original level as soon as the trial is complete. Dr. Louis Lasagna was an American physician and professor of medicine who, among other important contributions to clinical research, expressed what became known as Lasagna's law. He received his medical degree from Columbia University, completed a clinical research fellowship at Harvard Medical School, and founded the Tufts Center for the Study of Drug Development. He also had some very interesting findings during his career involving clinical research. There seem to be differing opinions on exactly what he said, but basically it states that sites are overly optimistic about their enrollment projections, and they'll generally overestimate by a large margin the number of patients they can actually enroll in the trial. This may not sound that surprising, but sites will often think they can enroll 30 to 40 patients per month for a cold or flu study, and then actually only end up hitting 10 or 15. They may think they have 100 or maybe even thousands of patients in a certain indication, but when the study starts up and you're ready to start enrolling, it's surprisingly difficult to find any new patients. Sponsors and CROs operate with this law in mind, whether consciously or not. They will respond to an unusually high number by cutting them anywhere from 1/2 to 90%. If your enrollment estimates are 5 times higher than anyone else's, the sponsor's first instinct is to assume your numbers are inflated, not that you can just do such a better job than everyone else. Unless you support your projection with facts and evidence and you really feel strongly your projection is accurate, back it up with your old metrics, such as numbers acquired from your database queries or EMR systems or how you've performed on previous similar studies. Now, the law isn't intended to accuse sites of inflating their projected numbers to get on the study, but there are so many factors that come into play. Between the time a site first looks at their database and when it comes to start screening and consenting patients. What a huge database of 10,000 asthma patients can suddenly get down to 25 eligible and willing patients. Here are some of the most important factors in this funneling process. Inclusion-exclusion criteria. As trials keep getting more and more complex with more and more criteria, just a single one can make or break the study for a site. Before starting to put your numbers down, try to get the full list whenever possible, not just the key criteria. You may find something buried deep in there that can cut down your potential population to almost nothing. Patients refusing to participate. Since we're dealing with patients, we have to take into account their own individual needs, desires, feelings, capabilities, and concerns. Look at the protocol summary from the patient's perspective. Even if they meet the criteria, are they going to say yes to the study? Are there invasive procedures, especially for non-life-threatening indications where a possibility of receiving treatment may not be worth having multiple biopsies? For an Alzheimer's disease study, do patients and caregivers have to be available for an excessive number of visits? Do patients sick with the flu have to come into the office and sit in the waiting room for several consecutive days? There's a myriad of reasons why the patient could back out. Next, patients withdrawing consent or lost to follow-up. Once the participant is enrolled, will they stick with the study or will they just withdraw and disappear? Patient retention efforts are just as important, if not more important, than recruitment efforts. This is especially true for certain studies like cardiovascular outcome trials that can require the patient to stay involved for 5 years or more. Screen fails. Screen failures play a large role, especially on some difficult studies where 90% of patients or more are expected to fail. Try to spot any items in the study summary or a criteria where you may expect a large number of patients to screen fail out of the trial. The key takeaway from this point is to be conservative with your projections without shooting yourself in the foot, and don't promise more than you can realistically expect to deliver. This will end up haunting you down the road and will certainly make it difficult to work with that sponsor again.
The fourth tip is to anticipate red flags. When you're filling out questionnaires or corresponding with a sponsor or CRO, pay attention to any answers you give that may sound strange or alarming. You may need to read your answers closely and critically, as something may catch the sponsor's eye that would seem normal to you or that you would never think would be a problem, but may stand out negatively for the sponsor. One example is for sites that are dedicated research facilities and don't treat patients outside of studies. We still constantly see questionnaires from sponsors and CROs that don't recognize that not all research sites are connected to a practice or hospital. If you fall in this category, don't just put not applicable or 0 for patient numbers and treatment questions. Explain your answer and describe your recruitment plan so the sponsor isn't left wondering why you even bothered to submit for the trial. Another example is sites that are brand new themselves or that have a brand new PI who's trying to break into research. If your site is new, pull out all the stops in describing your selling points. Is your PI GCP trained, and would any experienced sub-investigators be working with them? Does your coordinator or any other staff have research experience at other sites? If you don't have study experience for a given therapeutic area, describe success in similar areas, or let the sponsor know if you'd be working with a sub-investigator who does have this experience. And finally, read your answers back to yourself from the sponsor's perspective before submitting a questionnaire. Ask yourself, if you were the sponsor, would you choose your site? When completing questionnaires, be sure to include as much information as possible, even if it is not specifically asked for. Giving the sponsor additional information about your previous studies in that indication is key. Obviously, some studies will have different designs, thus different enrollment potential and expectations. But if you are able to provide metrics, including number of patients screened, randomized, and the enrollment length of the study, that does go a long way in the sponsor's decision-making. As you can see by the second response here, providing just 20 as an average on previous enrollment is not enough information for the sponsor to make a confident decision on your site. That could have been in 3 months or 2 years, so always remember to include more information. Oftentimes, at the end of a questionnaire, the sponsor will include a comment section. Use this. Perhaps you don't have any previous study experience in this indication. In the comments section, make sure to include how many years of experience the PI has treating these patients in practice, or similar studies that you've completed and metrics for those, if available. All the information you provide to the sponsor will be taken into account, so make sure you give them enough information to make a fully informed decision. Sponsors generally target sites that need little to no advertising, but requiring advertising isn't going to result in an immediate non-selection notice. Be honest with your site needs, but let them know where the patients will be coming from. Having a solid database of patients is always a good start, but if your site has relationships with referring physicians, a walk-in clinic, a nearby university, or another avenue for recruitment, be sure to make this clear. Sometimes advertising will be necessary, but the sponsor will often target sites that do not need much advertising. Again, be honest, but if the patients aren't there and you would expect 75% of your patients from advertising, maybe this study isn't the best fit. And finally, be proactive and follow up with the sponsor or CRO if you haven't heard anything for a little while. If they don't confirm receipt or follow up with you within a few business days, don't be afraid to shoot them an email. Maybe they aren't ready to move forward yet, but maybe that was the reminder they needed to proceed to the next step. Unless you know the timeline, it never hurts to send a quick email just to see where things stand or if they have any feedback. Also, it never hurts to pick up the phone instead of just sending an email. You can always call or even a follow-up call after an email if you haven't received a response in a day or two. Everyone has their own method, but sometimes actually speaking to someone can make a huge difference. If they don't expect anything to happen for a long time, then follow up with them periodically. But make sure to respect their time and adjust your follow-up attempts to the timeframes they provide. If the sponsor says the study is on hold for 6 months, don't call them in 3 weeks looking for an update. Harassing sponsors isn't going to help you get selected. In fact, it could have the opposite effect. The big stuff has already been submitted, and if they like what they see, they'll come calling. But sometimes a little push can go a long way. If you're working with a CRO, try to find out if the study has been awarded to them. Oftentimes, CROs will send out questionnaires to gather information from sites in order to assist with the bid defense. If that's the case, it could be months or even a year or more before they find out if they've won the study. And if they lose the bid, the opportunity will generally vanish as well. So, depending on the situation, it may be a while before you hear anything. And that goes for any study you apply for. And finally, keep track of the studies you've submitted to. Set up a spreadsheet or other system where you list the opportunities you submitted to and include pertinent information like sponsor, CRO, contact information, study indication, date of submission, and anything else you'd like to keep track of. Periodically follow up with the sponsors and CROs to ensure that none of the opportunities fall through the cracks, and keep track of any updates they provide. Some sponsors and CROs are great at sending out updates and notifying sites if they're not selected, but with others, you may have to do a little detective work.
Site promotional materials. There are also many options for additional supporting materials to help your case in getting selected. So make sure you have an updated website and be sure to reference it in your feasibility questionnaire. Believe it or not, your website can help you stand out among the rest. Also, keep a one-page document of your site's therapeutic capabilities, location, contact information, and on-site equipment. Include the number of patients with specific indications that you have access to in your database, and gather testimonials from CRAs, project managers, and other staff from sponsors to include in this document. Keep enrollment metrics of your studies and create a document of your enrollment history. And be honest, even if you didn't do so well, don't cherry pick. If your list shows that you met or exceeded enrollment goals on every single study, it'll be obvious that the list may not be 100% complete. Submit that document along with your feasibility questionnaire, CVs, and site information sheet. One thing to note, these documents, along with the PI's coordinator and coordinator CVs, should not be used in lieu of filling out questions about enrollment experience on the feasibility questionnaire. Don't make the sponsor dig for information that they need. So here you'll see an example of a site's website on the right and their site capabilities cell sheet on the left. What's great about these examples is they're laid out in a clean, readable way, and it's very easy for the sponsor or CRO to quickly see at a glance what the site's capable of.
So now let's get down to some of the stuff every site has concerns about. Let's talk about how to work through blemishes and potential shortcomings to still be a selectable site. Honesty is the best policy. If you are a new site or if your PI does not have experience in an indication or in clinical research as a whole, let the sponsor know. Sometimes studies do require previous experience, but other times they do not. If you are a new site or a new PI, Obviously, go after the studies where previous experience is not a requirement. Sponsors understand that you need to be given a chance to get experience, and it's not always possible to select only sites that have previous study experience, but you can stand out without previous experience if you make the extra effort. If you have a 483, be upfront. Include your response to the FDA when submitting a 483, along with any supplemental documentation like CAPA plans or an independent auditor evaluation. Explain what happened, along with what your site has done to rectify the situation and ensure compliance on their study, and what changes you have made since the 483. It's often requested, but if not, it never hurts to actually provide the 483 and audit documents up front, so the sponsor can better understand what happened and the changes you have made to ensure you have learned from past mistakes. The sponsor will also appreciate the transparency and your willingness to be upfront about any potential shortcomings your site may have. There are times that a sponsor or CRO will reject any site with a 483. Most sponsors are understanding and are willing to evaluate a site that can prove that they took the findings seriously, implemented a plan, and ensure the site is 100% compliant with GCPs and FDA regulations. There are situations where perhaps the PI or study staff that caused the 483 are no longer at the site. Make sure the sponsor or CRO is aware that you have new staff or procedures in place to ensure there are no issues moving forward. Oftentimes, just letting them know the site staff that caused your 483 is no longer around is enough for them to look past that. For studies you missed enrollment goals for, explain why. Was it a difficult protocol or a rescue situation? Don't give the sponsor or CRO the opportunity to come to their own conclusions first. Being blacklisted at a sponsor or CRO can be shocking. Always do some digging to find out what the reason is they put your site or your PI on the list to begin with, and see if there is anything you can do to have your site or PI removed from the list. Sometimes there is nothing you can do to be removed from the blacklist. However, it is important to learn from your mistakes. Even if there is nothing you can do, you can make strides to be sure you won't end up on another blacklist for the same reason. Also, if your PI was blacklisted and your site has another PI that can participate, see if the sponsor will accept that. Sometimes just changing PIs is enough to allow your site to move forward in the process.
Now let's talk about the good stuff when you secure a PSB. How to have a successful PSB. First, be prepared. Make sure the PI is present at the PSB, even if not directly requested by the sponsor or CRO. This is huge as it reaffirms your site's and your PI's interest in the study. If the site did all the work leading up to it and hasn't really kept the PI involved, it's usually pretty obvious. Make sure your physician is involved in the process and informed of where everything stands. Sometimes it can be tough to track down your PI, but if you expect to succeed on the study, the sponsor will expect that your PI has been participating in the feasibility process up to that point, and their presence and feedback during the visit is highly important. I've seen a number of times when asking the CRA or monitor how the visit went, where they'll say the PI didn't seem terribly engaged or knowledgeable about that particular protocol, which is a huge red flag as they don't want to select a PI who isn't either interested or simply isn't that informed. Be proactive and ensure you have thoroughly read the study design and are prepared to answer any study-related questions. Be enthusiastic. Having enthusiasm about the trial shows the sponsor that you're excited to get started on their study and make that a priority. Sponsors love hearing that you've been following their drug development and are excited to be part of it. These little things really do help you stand out to them, and they'll remember that you were very engaging, asked a lot of questions, and generally showed a high level of interest in participating. PI engagement is a huge plus and makes the visit very memorable for the CRA, and they'll surely make note of this in their report. Lay the building blocks for a productive relationship. This is your opportunity to start building a strong relationship with your CRA. If selected, you'll be working with this person or a colleague at a minimum for the next few months or even next few years, depending on the length of the study. It's important to get the relationship started off on the right foot. If the visit goes well and the above steps are taken, the chances are very good that the sponsor will want to work with you again and will give you the next crack at new opportunities that come their way. Having successful face-to-face interactions will lay the building blocks for a good relationship, not only on the study you're working on, but the sponsor's desire to reach out to you for future opportunities. The ability to form personal relationships within this industry will go a long way in helping you secure future studies and long-term growth for your site. Once you've conducted a study successfully with a sponsor, oftentimes they'll target your PI for future opportunities in other areas too. Even if the PI doesn't have experience in that specific area, And the last study the PI did with that sponsor was entirely different. But the positive work and relationship that was created in the last study was enough that they targeted your site for the next study too. As they say, sometimes it's not what you know, but who you know.
Put some significant thought into your recruitment plan to discuss with the CRA at your PSV. It will help both you and the CRA understand and plan your recruitment strategy. The CRA will want to provide as much useful feedback as possible, as they will also want your site to be successful on the study. A recent CenterWatch article about the best practices of high-performing clinical research sites found that 68% of sites failed to meet their projected enrollment target. The inaccuracy of the projections impacts the entire study, because now, to make up for this and to get the necessary sample size, another site will have to enroll even more participants, or the study timeline gets pushed out. A sponsor would rather have a site that makes realistic projections about their ability to enroll participants and meet study timelines, or asks for assistance when necessary, than a site that overpromises and doesn't deliver, even if both sites end up with the same enrollment and timing. Merck also ran a study on predicting enrollment numbers and sites discussing their recruitment plan in depth with their CRA, which found that to be the biggest indicator of which sites would be the most successful in enrolling patients into the trial. Being able to talk through potential hurdles face-to-face with the CRA will go a long way in ensuring this really is a good fit for your site, as well as the best strategies to pursue during the recruitment and enrollment period. They are there to help, and sometimes bouncing ideas off your own staff won't be enough, and the CRA, who should have a solid foundation of knowledge about the study, could perhaps provide tips or ideas that your staff didn't think of. A well-thought-out plan and discussion with your monitor about recruitment will put you ahead of the pack and on the road to selection. Now, this next section may seem to contradict everything we've been talking about, but knowing when to walk away from a study opportunity is an underrated talent. In our own experience, some of the best performing sites in our network are the ones that turn down most of the opportunities they receive. Cast a wide net, but don't take every study that comes your way. Don't take on competing trials or studies you know you won't do well on. Taking on too many bad studies leaves you unable to consider better opportunities that may come your way in the future. The sponsor would rather your site back out than to move forward and do poorly. Plus, they'll remember you were wise to back out if you didn't think you'll succeed, and they will keep your information on file or in their database and reach out to you for similar or different studies in the future. Requesting additional information or even guidance from the sponsor never hurts. If you aren't sure you can do a study, or if you have something potentially competing but aren't sure, you can always check with the sponsor to see if they would compete. They should be able to tell you whether the inclusion-exclusion criteria, or IP, for example, would get in the way of another trial. The sponsor would prefer a high-performing site and likely wouldn't select your site if they expected you to fail. If you think you might have a competing trial but aren't totally positive, perhaps the sponsor can help confirm your doubts. Don't be afraid that the sponsor won't come back to you for future studies if you do say no to this one. If they've contacted you for one study, odds are they'll probably come back to you the next time they need sites for a trial. And it's much better to run that risk than to take the study just to get on the sponsor's list and then perform poorly. Ask questions and request more info about the study in order to determine if it's the right fit, such as a protocol synopsis, schedule of events, or inclusion-exclusion criteria. Much of the time, the information you'll get during the initial site selection stages is very bare bones. Often, the sponsor will have their own rules for when they can send you certain information, and they may want you to complete an initial questionnaire first in order to be issued a CBA and then be sent more information. Asking for more details may not always work, but it's certainly always worth the attempt, and it can save you from wasting time and effort on opportunities that turn out not to be a good fit for your site. If you have to turn down a study, let the sponsor or CRO know right away. Declining a study in itself won't keep you from being considered for future studies, but turning it down after the sponsor's made a lot of investment in your site definitely leaves a negative impression, especially if it's for a reason that should have been obvious at the outset. One of the worst mistakes sites make is to move forward enough in the process that your site is getting a PSV and then decline once your site has been approved. Even worse, and I've seen this a few times, is when the monitor is at your site doing the visit and you come to the realization that the study isn't a good fit or that you don't have the patience. Now, the sponsor has wasted the money and resources sending their CRA to your site only to have you discover right then something you should have already known. If you aren't sure, look into it and make an informed decision, but do your best not to waste the sponsor's or your time. Declining the study that late in the process will surely leave a bad taste in the sponsor's mouth, and it might put you on the naughty or do not use list for future opportunities. And be cautious if you receive an opportunity for a study that's already begun enrolling subjects. Sometimes the study may have just started and the sponsor is still working on the selection phase while the initial sites start enrolling. Other times, the study may have been active for a while and in need of rescue or add-on sites. This should raise a red flag that there may be some important reason why more sites are being added now. Maybe it's a difficult protocol or the inclusion-exclusion criteria makes eligible patients impossible to find. Don't be afraid to ask questions of the sponsor or CRO, such as, what's the reason they need more sites? How long has the study been open? When will the enrollment period end? Sometimes these studies are almost finished, so by the time you're IRB approved, contracted, and initiated, you may find out enrollment's closing in a week. And even if the sponsor tells you it'll end in 6 months, if all the new sites start performing strongly and enrollment picks up, they could suddenly finish the study well ahead of schedule. But participating in a rescue study isn't always something to avoid. If you have the right patients and nobody else does, you can come out looking like a hero in the sponsor's eyes. But many times, it can be a lot of investment up front without any guarantee you'll be able to randomize enough subjects to make it worthwhile.
Planning for the future. With the still shaky state of the clinical research industry, it's all the more important to be creative and constantly look for new ways to grow. Consider hiring a full-time patient recruiter or marketing coordinator, or even establish a close relationship with a patient recruitment agency to ensure enrollment on the studies that you take on. Diversify your research site. If you're focused in a narrow area of research and are seeing fewer opportunities, can you forge relationships with investigators in other specialties or recruit and mentor a physician who hasn't been involved in research to become a new investigator for your site? Finding new areas to break through or a new physician to recruit for a not so common indication is never a bad thing. On the flip side of that, you can expand into a niche therapeutic area and focus on identifying studies or patients that specialize in that area, thus potentially shooting to the top of the sponsors list for that tougher indication that they really need help with. Depending on where you're at and what you're looking for, sometimes diversifying or just really focusing on one particular area can help bring new opportunities. When rejected for a study, try to find out why. You may not always get the answer or the answer you'd like, but this can be important feedback in case there's anything you need to change at your site to have better odds next time. If you didn't have the patience or the experience wasn't the one they were looking for, that happens. But it's good to know the reason wasn't an issue with your site that you just weren't noticing.
There's no secret or trick that will get you on every study every time. Even if you seem like the perfect fit, there's always a chance that it doesn't work out. External factors may keep you off the sponsor's list. For example, there may be other sites in your area that would compete with you, or there may just be too many qualified sites and too few open spaces. And different sponsors and CROs will have different needs and criteria for site selection. But you can take many steps to maximize your chances and cut down on wasted time and effort. Make sure you're going above and beyond in trying to stand out among the other contenders. Responsiveness and high-quality data are key. You can overcome blemishes, just be upfront and forthcoming about it. It's much better to notify the sponsor of a 483 than for them to find out another way and have to drop your site because of it. Discuss your plans internally on how you will recruit and enroll subjects. When the staff are all on the same page, it makes for an easier process. Same goes for when you secure your visit and the monitor is on site. Discuss with them your plans and see if they have any feedback to provide. If the study doesn't look like it's the right fit, or if you're afraid you'll do poorly, there's no shame in throwing in the towel. 10 times out of 10, the sponsor would prefer you back out and not waste their time and money than to take on the study and not enroll anyone. And finally, think about ways you want to grow. What are the best strategies to setting yourself up for new opportunities in the future?
So that concludes our webinar. I think at this point we'll pass it back to Lauren to start the question and
Unmuted.
answer.
Thanks, Lindsay and Alex, for that excellent presentation. So just in case you guys have any questions, please submit them at any time during the Q&A using the GoToWebinar question box on the right-hand side of your screen. So we already have a few questions in. First question, of the studies your site submits to, what percentage of those studies are awarded to your site?
Do you want to answer that one, Alex?
Yeah, so what we've seen is about 30 to 40% of the time. So I'm not sure if that's a little lower or a little higher than you might expect, but I mean, given that information, I think those are still pretty good odds.
And with that said, more specific or difficult the indication is, I would say the higher likelihood of being selected the site will actually have. So that just kind of furthers the point that we were making earlier about kind of finding your niche area.
All right, awesome. Next question. How is site selection aligned with budgeting?
I guess I would need a little bit more information, but typically what we're seeing, we're definitely seeing a trend where sponsors are requiring sites to provide budget information during the selection process. You know, and we kind of feel two ways about that. Obviously, we don't want to all put in a lot of work up front just to, you know, at the end of the whole startup process, not be able to agree on a budget. But at the same time, you know, we're sensitive to the amount of work that sites put in during the selection process, ultimately to never be selected on the trial. And I'll also say that I think the experience the sponsor CROs have through the site selection process, so if that's things like responsiveness, promptness, professionalism, I think you're going to set yourself up by doing well with those things to, you know, really show the sponsor later on down the road that your site warrants a higher budget because of professionalism and experience your site showed up to that point.
Okay. All right, next question. When you are not selected for a study, how often does the sponsor or CRO provide feedback as to why you were not selected?
Yeah, so I feel like most of the time when you ask for the feedback, you'll get it. There's a few sponsors that I've worked with that it's their policy not to provide that information, but I would say 9 times out of 10, if you go back to your sponsor or CRO after you get a non-selection notice and ask them why you weren't selected, usually you get a response, whether it's lack of experience, patience, maybe it is geographic dispersion problems. So I think about 9 times out of 10, the majority of the time, you'll get that feedback.
Okay, great. All right, next question. After working on a study with a sponsor or CRO, how often does the sponsor or CRO contact your site directly for future studies?
Yeah, that's a good question. So I would say for the smaller sponsors and CROs, they are probably much better at keeping track of who they've used. They have the time to develop those personal relationships, so they'll literally remember working with you last time around. But I will say, you know, the larger sponsors and CROs, oftentimes their site selection team is divided by therapeutic area or some other division, whether it's geography or whatever. So they may not have directly had the experience working with a particular site. And what we've seen is they're not so good at, you know, sharing that type of information. So unfortunately, that's one of the biggest obstacles in identifying new study opportunities. It's not as simple as saying, hey, you know, we've worked with this company before. Obviously, they'll come to me for their next study. Unfortunately, it doesn't quite work that way.
Yeah, and also just to jump on that too, if it's a more common indication like asthma or diabetes, I mean, these sponsors are going to have hundreds of sites to contact. But if it's more specialized, like maybe a cancer study or a rarer indication, they probably have a much shorter list. So if your site does have like a specialized niche therapeutic area, you'll probably hear about those types of studies a little bit more often.
Okay, great. What do you do in the event that your site needs to put together a budget proposal for a sponsor and they really want to use that sponsor? Should we be aggressive even if we know the study will be difficult?
Yeah, honestly, there's nothing worse than going in with a low budget and then, you know, during the site selection phase, and then once you're actually contracting and negotiating the budget to have to up that. And we're big proponents of sites never taking a budget that isn't actually profitable for their site. So while it's a slippery slope, we really recommend sites, you know, track what their true costs are and be honest with the sponsors and CROs with, you know, what they need right out of the gate. Likely you're not providing, you know, a budget that's going to blow them out of the water if you're truly, tying it back to the cost of your site.
Okay, next question. When reviewing a protocol and completing the questionnaire, how often is the PI involved in the study review / FQ completion process?
So this is kind of difficult because sometimes if, for example, like the study coordinator at the site has worked there for 10 or 20 years, they might have enough knowledge about the site's capabilities and the protocol to answer some of the questions themselves, but it is probably in each site's best interest to have the PI involved, at least in some capacity. So, obviously just to know that the PI is interested and you're not just filling out on behalf of the PI only to have them look it over later and decide they don't want to do it. But I think it is really important to include your PI in that review process and get their feedback when you're working on the questionnaire.
Okay. After your site has a pre-study visit, about how often is your site getting selected for the study?
I would say we see about a 75% average there. And from a timeline standpoint, it varies pretty significantly. There are some studies where the majority of sites that are submitted on the trial will get PSVs, or at least that first bunch that submits the questionnaire will get the PSV. But then there are other studies where the process is much more drawn out, and they're looking for geographically dispersed sites, and they're being very selective from that standpoint. But I would say overall it's about 75%, and there are also times where the sponsor or CRO won't make a final decision until they've visited every single site that they've set up PSVs for. So the timing of that process can vary pretty drastically from study to study.
Okay, thank you for that. Next question. When asked to provide a copy of your 483 to the sponsor, how often is your site selected for that study?
That's a good question, and I've seen it both ways. So, and I kind of touched on it earlier during the webinar, but it's not a death sentence to have a 483. Just make sure that, the sponsor will probably ask for the document and your response. So just make sure you have that it's readily available, and then if they have any further questions about it, just follow up with them and be professional and honest with them. I don't think having a 483 is going to knock your site off the sponsor list immediately, but how you kind of got back out there after you did get it, kind of your response to that is the big factor. So just, be professional, and be honest with them, but tell them and make sure they know that you've made changes, and then that it won't happen again.
All right, and I think that we have our last question. If anyone has any other questions after the webinar has ended, you are more than welcome to contact either the Clinical Conductor webinar series or PharmaSeek to get answers to your questions. All right, last question. When completing the feasibility process for a study indication in which you have no previous study experience, how often are you awarded that study?
Yeah, that one can also vary. I would say for those general indications like asthma, type 2 diabetes, flu, cold, they're highly, highly competitive. So those probably aren't the best studies to start submitting on if you have no previous experience. As we kind of touched on, it's a good idea to kind of find your niche and then expand from there. So your PI, can really find its focus area. And then once the PI has experience, we see it's easier to break into different therapeutic areas. So I would say, honestly, if you have no experience and you're submitting on a general indication study, you're oftentimes not going to be awarded that trial. But if it's for more of a niche area and you have a sub-I that you can submit with experience, then your chances are going to get higher.
All right. Well, thank you guys so much for that wonderful Q&A. Just a reminder to everyone that the slides are going to be sent out via email within 24 hours of the webinar ending. Thank you for everyone for attending the presentation today. We hope that you found it informative and interesting. And a big thanks again to Lindsay and Alex for presenting. And be sure to be on the lookout for the next installment of the Clinical Conductor webinar series. Thanks, everyone.